you don't have to worry about what is causing the arrest. Okay? The main idea for us all, remember this, is not to find out why the patient has collapsed. Our idea is to act on it. Our main aim is to start basic life support and CPR to maintain the organ pressure. What happens whenever there is a arrest or whenever the heart stops? There is no blood flow from the heart to the brain. That is the most important thing. Because in the brain we have very sensitive cells. If oxygen is not there even for 5 to 10 minutes, if the oxygen supply is not there for these cells, the brain will die, the cells will die. And if this damage happens, whatever you do to the body, the patient is gone. Okay? The main idea is to keep the brain circulated well. So what you try to do is you pump the heart, get the blood going into the brain. You can't get all the blood to the brain, but how much ever possible, you have to get the blood to the brain. This prevents that what you call as hypoxic brain damage. That is, whatever oxygen which is carried in the blood to the brain will be going on when you do the basic life support. So 3 important steps. If you remember this, today's class is done. So if I have come all the way here, if you remember these 3 things, I would be very happy if you remember. The first thing is secure the scene. Okay. Second one is check for response and check for pulse. These 3 things are important. Okay. So what is securing the scene? See, we understand the person who has collapsed is important, but more than him, you also have to be very secure. See, for example, somebody is collapsed in the water, or somebody is collapsed near the electric source, or there is some fire. You can't jump there and start doing a CPR because you will be at threat. So first is you pull the patient out of the water, pull the patient out of the cardiac electric source or the fire, or in heavy traffic. If somebody has an accident and is in the heavy traffic, pull him out. Make the scene secure, make yourself secure. Understood? Okay. So you clear from the water, traffic, electric source. Always make sure the patient is lying flat on his back so that your basic life support and CPR will start on the flat surface, and this should be secure area. Okay. So next, as I said, secure the scene is over. The second one is check for response. How do we check for response? You just go, stand on the side of the patient and just tell them, how are you? Are you all right? Okay, that is the check for response. This is the second step. Okay. Kneel by the side of the victim and check for response. I'm going to demonstrate everything here, but remember this. Okay. How are you going to check the response? Shake the shoulders and say, are you all right? If he responds, okay, that means the patient is not in a cardiac arrest. There are 2 things. Everybody will think heart attack and cardiac arrest. Remember this, heart attack is different, cardiac arrest is different. Okay. Heart attack means he's just got some problem in the heart, but the patient is not arrested. The heart has not stopped. The patient, what happens in heart attack is patient will fall down, but he'll be breathing, he will be groaning, moaning, kind of thing. Okay. But if a cardiac arrest happens, the patient will be completely unresponsive. There is no breathing, there is no sounds, nothing, no response at all. So, okay. So this is if the patient is responsive, leave him as you find him, find out what is happening, why he fell down, and keep on reassessing regularly. What is happening? You keep on calling him, how is he, and eventually he will be awake. In cardiac heart attack, usually they will be awake. You don't have to do CPR or basic life support with them. But our main role comes when the patient becomes unresponsiveness. This is called as a cardiac arrest scenario. Okay. Sometimes what happens is patient is in cardiac arrest and you can just feel this kind of breath. These are called agonal breaths. This is not a normal breathing. So when you see a patient, you shake him, you say, are you all right? No response. And there is this breathing. You don't have to wait. These are the steps you have to take. This is the most important thing. Don't be a hero. First thing is you call for help. That is the most important thing. That is the first chain, link in the chain, if you've seen. Shout for help. Activate the emergency medical service. So what is emergency medical service? If you have a cell phone, the code here is 108 ambulance. Okay, that is the most of the people don't know this. It's very easy. Just take your mobile phone. Everybody has a mobile phone now. Just call 108. Your 80% of the job is done there. Okay. Then, if you are alone, then sometimes you would have seen some AEDs kept in different malls. That's called artificial external defibrillators. You would have seen in the movies where they go and do a shock and all. So in big malls, airports, or some big hospitals nearby or schools also, they would have kept some box, just like fire extinguishers kind of thing. You need to get that. So you have to ask somebody who is next to you to get the AED machine. This is what happens when the patient is unresponsive. So the first important thing is call for help, activate the EMS, and send somebody to get the AED. You will be next to the patient. Patient is unresponsiveness. What is the third important point? Beautiful. Check for pulse. How do you check for the pulse? 2 fingers. Everybody hold the 2 fingers. Okay. On the side of the neck. Just place it. Okay. Yeah, it should beat. Otherwise you are not alive. So that is the way to check the pulse. So what happens is, everybody can feel the pulse, isn't it? Yeah. So it's not always like this in this scenario. Okay. Sometimes the pulse will be very feeble. Sometimes you might not feel unless you've been exposed to it. So if you're in doubt also, you take it as no pulse. Okay. Always do it something which is useful for them. Sometimes we feel, sometimes what happens is, if you, in our hospital it happens, we press it so hard, sometimes some people will be athletic, sometimes they can feel their own pulse there. They'll be feeling their own pulse and they think it is the patient's pulse, and they'll stop CPR. So if CPR is not done even for few seconds also, the brain damage will happen. So don't wait for, if you're in doubt, start CPR. So you check for pulse. If the pulse is present, okay, the next is, anyway he's not breathing normally, you have to assist his breathing. How do you assist breathing? There are different kind of techniques which I'll show you. Usually the classical thing what they do is mouth to mouth respiration, but sometimes nowadays what happens, a lot of infective patients, a lot of blood threats and all those things, so people are afraid to do it. So we have these devices. There will be some mask, a small mouthpiece or a mask where you can blow through the mouth. This is the mouth to mouth respiration. And we have something called as a ambu bag, rescue bag, which will be there when the paramedics arrive. With that also we can give a rescue breaths. These are all when the pulse is present. What happens? See, I'll come back to the same thing. Patient is unresponsiveness. You shout for help. You check the pulse. Pulse is not there. This is where the most crucial part of the basic life support happens. What do you do when pulse is not there? Start CPR. The most important thing is start CPR. Even if you are doubtful, pulse is not there, start CPR. Wonderful. Very good. So how do you do? See, nowadays whatever we have something called as a AHA, American Heart Association. They recommend the most important thing in the basic life support is cardiopulmonary resuscitation and defibrillation. Defibrillation, I'll tell you what it is. And cardiopulmonary resuscitation, they say push hard and push fast. Okay. You don't do anything, just stand next to the patient and start doing this. You're going to save the patient. I'll tell you how to do the CPR also. So this is how you place the hand. First you keep one hand like this. Can you see it here? So this part is called chest, and this is between the nipple, and this is called the sternum bone. So just lower part of the sternum bone, between the nipples you place your one hand, and you place your other hand on top of this. Okay, interlock this. I'll show you how. Okay, and make sure always you have to be next to the patient on the right side. I'll show you just, and your elbow should be locked. You should not leave it like this. Your elbow should be locked. Okay, and you have to keep on giving this pressure. Okay, and the force has to come from here and from the hip. If you're kneeling next to the patient, you have to kneel it and do it. Or if the patient is always, usually the patient will be on the ground, and I'll show you how it is done. Kneel like how they do it. I'll show you how. Because this is how you place. The placement is important. If you place the hand somewhere here, if you place the hand somewhere here or in the abdomen, it's not going to help. This is the most important point. You have to compress the heart, because heart lies just below this. If you do the proper compression, then only heart will get compressed. The blood will go to the brain, and you can avoid the brain damage. The most important thing is to avoid the brain damage. That is what you have to do here. Okay? How much you have to compress? Not like, you should not do that. Okay? There is actually a song. If you have heard Staying Alive song, you have to base your compressions like that. Like 1, 2, 3, 4. Staying alive, just like that. It has to be rhythmic. Okay? So when you start that, in a minute you should be able to give 100 compressions like this. Okay, 1, 2, 3, 4. So in a minute you have to give that 100 compressions. Okay, and when you that is called as push fast. 100 to 120 push fast. Okay, and depth is also important. You just give, if you're hungry, if you're tired, then probably you don't have that much of energy. You will not be, you should push around 2 to 2.5 centimeters approximately. That is called as push hard. So push fast and push hard. And whenever you do it, if you keep on doing faster, and if you don't allow the chest to recoil, this you press and this is recoil. Now, if you don't allow the chest to recoil also, that adequate CPR doesn't happen. So push, recoil, and push harder. Okay, allow the chest to recoil and push at 100 to 120 compressions per minute. This is the most important component of CPR. This is what you're going to learn now, how to do the CPR properly. Even if you're next to the patient, if you don't do the CPR properly, there is no use. Okay. And sometimes, see, this is not, it looks very easy, but when you start doing it, you'll know how difficult it is. It is very tiring. You have to put a lot of pressure, and usually by the end of 2 minutes, you'll get tired out. So if somebody is next to you, always make sure you don't continue, because if you're tired, you will not be giving adequate compressions. The patient will be tired. So you ask somebody to take over every 2 minutes, okay? So what happens is, whenever we are giving this, okay, for every 30 compressions, somebody, either you or somebody who is next to you, they can give a mouth-to-mouth respiration called as rescue breaths or a mouthpiece respiration. So for every 30 compressions, you have to give 2 rescue breaths. Okay, that also I'll demonstrate how it is done. So as I said, push hard. How much centimeter depth or how much inches depth? 1 You're good. And push fast? 100. Excellent. So that is called as high quality CPR. High quality CPR is the one which is going to save a lot of life and reduce the mortality. Okay. The next comes a defibrillation. So what you have done is you have activated somebody, emergency medical system. You checked for the pulse. You started the CPR. And meanwhile, before that, you have asked somebody to get the AED, isn't it? So don't talk. Listen here, because this is important. Okay. So somebody will get the AED. Okay. Your AED machine will look like this. It will be kept in the wall. It will be, as I told, in one of the big malls. Everybody will know. Most of them, if you ask for an AED, if you ask the security person, they know it is kept there. Go and get it. Otherwise, if you already activated the emergency medical system, the nurses or the paramedicals in the ambulance, they would have already got it. Okay. That is the AED, what it has. Keep it here. Okay. This is how it looks like. Okay. This is how the AED looks like. So you have to keep on continuing the CPR until this arrives. Okay. Whoever brings it. Once this comes, what is AED? It is a new generation smart defibrillator. Defibrillator is nothing but the one which shocks the heart. Shocking the heart is called as defibrillation. Okay. What happens sometimes? Heart fibrillates like this. Normally heart pumps like this. Sometimes in cardiac arrest, heart fibrillates like this. If it fibrillates like this, the heart pump doesn't happen. The blood doesn't pump. Defibrillation is, it defibrillates it. It makes the heart pump to come back to normal pumping rhythm. So what happens is, it interprets what is happening and it only delivers the shock. You don't have to do anything, you just have to connect it. And what happens, when you switch it on, it automatically, it will tell by itself what to do the next step. These are very good. These are new generation ones. Okay. So AEDs will automatically, once you keep the AED on, you open it. Sometimes when you open it, automatically gets switched on, or sometimes you have to manually switch it on. The next step is open the shirt, and you have to keep the pads. 2 pads will be there. One has to be kept on the right side, and one has to be kept on the left side. Okay. And the mark where to be put also, it will be mentioned in the pads. And so until this part, you should not leave the patient. This has to keep on going. Whatever happens, this has to keep on going. You stuck the pads. The moment you stuck the pads, what happens is, it starts to analyze the rhythm. What is happening in the heart. Automatically it recognizes it. It will tell you, okay, this is the time to get out of this thing, clear the patient, because it will be shocking the patient. There might be chances that something is happening in the heart, you might shock it, or there might be chances that you might not need a shock also. So what it will do is, it will analyze the rhythm. It will tell, patient is ready for shock, I'm going to shock it. That time you have to clear the patient. The AED will give a shock. Immediately after the shock, you have to start the CPR. So don't have to stand back. Start the CPR. CPR has to be continued for how many minutes? No, that is 100 compressions. If somebody would have seen, no, CPR has to be continued until everybody comes. But this AED attachment, usually it's for 2 minutes. 2 minutes and then check again. Once you connect the AED, continue the CPR for 2 minutes and then check for again AED. That's how you do it. Okay. So usually shock indicated, they say stand and clear. And once shock is delivered, again you continue CPR. That is 30 compressions, 2 rescue breaths. 30 compressions, 2 rescue breaths until the patient, until the emergency response team or the paramedical services arrive at the scene. Okay. And then later they come, they put the tube and then they take over. They stabilize the patient, they take to the ICU emergency and all that. Okay. But what happens is sometimes before they come, you start the CPR. Maybe if you're very good, you're extremely strong and you restart the heart. Okay. That time what happens is patient becomes awake, he starts groaning and moaning. And the respiration starts, normal respiration. That means that time the patient is come back to normal state, like he's alive, you restarted the heart. So at that time what you have to do is, you don't have to do any shock or anything. You have to put him in the recovery position. Recovery position is, you turn him to one side and keep the hand in that position and make him lie down and keep on watching. Okay. Every minute you keep on watching, because he can go back to cardiac arrest again. Look at his breathing, keep on asking, how are you, how are you? Again, if he becomes unresponsiveness, again the pulse is not felt, you go back to the same cycle. Okay. So how do you know when to stop the CPR? Victim starts to breathe normally, or the medical assistance comes and they take over the CPR. And if you're physically exhausted, sometimes what happens is you yourself is a heart patient. You keep on giving the CPR, you start having the chest pain, you will be the next person who needs a CPR. Okay. So if you're extremely exhausted, then you have to ask somebody to take over. There's no other go. Okay. As much as possible, you have to keep the CPR going on. And how do you know? The patient starts breathing, coughing, some movement will start happening, and sometimes skin will be blue. It will start becoming pink again. Skin becoming blue is a sign of hypoxia. Once the heart starts back, the skin becomes pink again, and you can sometimes feel the pulse also. The pulse comes back. Okay. Okay, that is about the basic life support. One more interesting topic in basic life support is choking, which I'll tell you later. So shall we revise once again? So to make sure, if